who has a history of chronic Hep C, and this is an outside imaging study that was brought to us for a second opinion, and he was basically referred to the liver tumor clinic. The pathology doesn't project very well, but what we see here is the left lobe looks atrophied, and there is some mild intrahepatic biliary ductal dilation. And if you see carefully, my arrow points to a dilated left hepatic duct with a mass within the duct. And here in the coronal plane as well, let me put these arrows right here, there is an enhancing soft tissue extending into the bile ducts. We had just a single phase CT, but based on all these features, we proposed that this might be an intraductal cholangiocarcinoma, which is giving rise to this chronic atrophy of the left lobe and dilated left-sided ducts. So sure enough, this patient went to, they took the patient for an Ercp, and here are the Ercp images. You see like a filling defect protruding into the CHD from the left side, suggesting that there might be a mass within the left hepatic duct. And here is the image right here. On the right side, you can see these bile-coated mass protruding into the CHD. So let me move forward. So here is the pathology report from the biopsy. So it came back as a CBD mass, but it came back as a hepatocellular carcinoma, moderately differentiated with extensive necrosis. So I was a little surprised, but there is an entity which is an intraductal HCC. This is a rare entity seen in 1.2 to 9% of HCCs can be purely intraductal. And it has a specific name to it, which is called icteric type or cholestatic type, because it presents with biliary obstruction, and it resembles very closely a cholangiocarcinoma on imaging, and therefore it is often misdiagnosed as a cholangiocarcinoma. I just found case reports when I looked into literature for this entity, and they say that on imaging, if you do like a multiphase CT or a multiphase MR, you can see an associated hepatic mass, which may show arterial enhancement and washout, just like your typical HCC. And mainly it's a mass that is outside the bile ducts, but which is invading into the bile ducts with imaging features suggestive of an HCC in the form of arterial enhancement and washout. And that's kind of your only clue distinguishing it from a cholangiocarcinoma, which would have, delayed enhancement on the post-contrast, etc. Management is, of course, surgical excision. So
wait, can you, when you looked back on the images for that case, did you feel like maybe there was an hepatic component? And did they have a history of like liver disease or anything, or?
So yes, he had chronic Hep C. He had Hep C, but the problem here was this was a single phase, and no matter how much I windowed these images, I could not make out the component within the liver. But the op note, so they went in for a left hepatectomy kind of, and the op note did describe, like the pathology from that did describe a larger component outside in the adjacent liver parenchyma, which after this outside study, we were also convinced this is a cholangio. They didn't get any additional imaging at our place.
Cool. Steve said that's a new one. Wow.
Yeah.
Really interesting.